So, hi everyone, and we are back again after a long time. I do apologize again for the long delay in videos, and this time hopefully I'll be a little bit more consistent. But, anyways, uh, our topic of discussion today is inflammation, as you can already see. This is one of the most important topics in not only general pathology but pathology in whole, because many aspects in systemic pathology also deal with inflammation in different body parts or body organ systems. So the general idea of inflammation is obviously a very important one, right? So that's why I thought that this would be probably the best chapter to start with. Although there is another chapter before this, which is cell injury, and that is also a very important chapter, but I think we can manage without it for now. We will obviously be dealing with that chapter later. So as you can see, this time I have already written down a lot of things because I want to actually keep this first video short. We won't be dealing with the detailed inflammatory processes in this video. That will be started from the next video onwards. This video will only be about a very general overview of what inflammation actually is for people who do not know about inflammation, who have no idea what inflammation is, probably have only heard the term, do not know what it actually means, do not know what it actually represents. For them, a very general overview of what inflammation is, its different types, the differences between the types, and the causes of inflammation. So this is a very general overview of inflammation. So as you can see, I have already written down the definition that it's actually a response. Inflammation is actually a response. Of what? Of vascularized tissues. What happens in that response? In that response, host defense molecules like neutrophils and the other leukocytes, they are delivered to the site of infection and cell damage from the circulation. Why? To eliminate the offending agents. So let me explain what this definition actually means. Whenever we are infected with some foreign bacteria or some foreign agent or a microbe, whenever, obviously we will see this later, that there are a lot of causes for inflammation to actually occur, but let's suppose that we are infected with a bacteria. Okay, suppose this is a bacteria, this has infected our bloodstream. So now what our body would like to do is, obviously it would respond to this threat, it would like to eliminate this threat. To eliminate this threat, our body would recruit, or our body would rather go through some processes which would recruit our body's host defense mechanisms, which include the leukocytes. These leukocytes, what they will do is, they will eliminate the source of all the problems, which is in this case the bacteria, and they will also initiate the repair of all the damaged cells and the damaged tissue caused by the bacterial toxins. So inflammation is not only our body's response to some external offending agent to eliminate that source, rather it is also an initiative by our body to repair the damage caused by that offending agent in the first place. Now remember, the leukocytes not only repair and not only do they remove the offending agent itself, but they also eliminate the damaged, they also eliminate the damaged cells and tissues. Okay, the host damaged cells which are beyond repair, they are also actually eliminated by the leukocytes. So I have mentioned here that this is more or less a response of vascularized tissues. The reason I have mentioned vascularized in the definition is because blood flow blood vessels, they play a very important role as far as the inflammation process is required. Why? These leukocytes, first of all, where are they circulating? Leukocytes mean white blood cells. So they are blood cells, right? So they are in the blood. So they are in the bloodstream. So they need to be transported to the site where the infection is taking place or where the offending agent resides or is causing damage, which is the site of inflammation, right? Or rather, which will become the site of inflammation once the leukocytes reach there. So for delivering these leukocytes, what is the delivery system? What is the universal delivery system in our body? Blood. That is why we have mentioned the term vascularized in the definition. Okay? Right? So again, let me remind you, inflammation is not only about eliminating the offending agents, but it is also about initiating the processes required for repair of the damaged tissues and cells. This is more or less what inflammation is about. Now, before going on to the typical inflammation sequence, we will obviously be dealing with inflammation process, or rather acute inflammation process, in a lot more details from the next video onwards. But before that, a very generalized overview of what a typical inflammation sequence looks like, that we will see. But before going into that also, I would like to say, and you can probably guess this, that these leukocytes, I said that they are eliminating these bacteria in this case. I'm only exemplifying here. It's not only going to be bacteria, it's not only going to be virus, something like that. It can be a host of etiological reasons. We will see to that later. But in this process of inflammation, where the elimination, or where these leukocytes, they are actually eliminating the offending agent, a lot of times the leukocytes, they also end up hurting the host healthy tissue as well. That is why inflammation is actually injuring to the host tissue as well. So it is kind of a double-edged sword, if I am to say. So inflammation is a double-edged sword. On one hand, you need inflammation for doing all this, the useful things of inflammation, but on the flip side, the host tissues also gets injured in the inflammation process. And depending on what kind of offending agent you have and how easy it is to eliminate the offending agent, this damage, the damage caused by the inflammation to the host, that will vary. If the offending agent is easy to remove, then it's not going to be too much damaging for the host tissue. But if it is very hard to get rid of, then inflammation will persist, then it will be very derogatory for the host tissues. And then the damage to the host might outweigh the beneficial effect of inflammation. Then inflammation might become damaging and not helpful. Anyways, this is something which is actually linked to the definition and the concept of inflammation. We will come to this concept later, this balance between harm and goodness, you might say, of inflammation. We'll come to that later when we talk about the types of inflammation. But now, let's move on to the typical inflammation sequence. Typically, what happens in an inflammation sequence, as you can see, this is actually very well versed and it is very easy to remember. It is actually a combination of 5 R. 5 R's. What are the 5 R's? The first R stands for recognition. Recognition of the noxious agent. First, let's get on with the 5 R's and then we will come to them later, one by one. So first is recognition of the noxious agent, and second is the recruitment of the leukocytes and the plasma proteins. Third is obviously removal of the inflammatory stimulus, which is the stimulus which is actually causing the inflammation, the stimulus for inflammation, which means the offending agents. Then after removal, or rather throughout the removal, throughout the inflammation process, there is a regulation of the inflammatory response, because like I mentioned right now, that inflammation is a double-edged sword. So you always have to balance, our body has to balance, the host has to balance, and it has to actually ensure that inflammation does not become a damaging process, because inflammation is somewhat damaging to the host tissue as well. So regulation of inflammatory process, or the regulation of the inflammatory response, is very much required. Otherwise inflammation would become self-harm inflicting. Okay. And last but not the least, like I mentioned before, that inflammation is not only about eliminating the offending agent, but also the beginning of the repair mechanisms. So repair of the affected tissues. These are the 5 R's as far as the typical inflammation sequence is concerned. Now obviously inflammation can be of multiple types, actually it can be, but very grossly it is of 2 types. Okay. Before going into that, let me actually show you a picture which is kind of elaborating the 5 R's. Okay. So what does this actually show us? See. Okay. Yeah. See, in the first case, we are seeing that the microbes, in this case, they are the offending agent, right? So the microbes, what they are doing, they're actually entering the host tissue, right? Now microbes can be a stimulus, necrotic tissue can be another stimulus for inflammation. We will see to the etiology of inflammation in just a bit, but remember that just like I mentioned, microbes can be a stimulus for inflammation, necrotic tissue, whatever may be the reason for the necrosis, but necrotic tissue itself can be a stimulus for inflammation. So whatever be the stimulus, this is the stimulus actually. Stimulus. Now, upon entering or upon releasing some certain factors, these are actually identified, these are actually recognized by the resident cells, mostly by macrophages, most commonly by macrophages. Okay. So it might be macrophages, it can be dendritic cell, mast cells as well. These are typically the cells which will recognize, remember the first R in the typical inflammation sequence? Yes, recognition of the noxious agent. They recognize the stimulus, and what they will do is release certain chemical mediators. Chemical mediators of what? What do these chemicals mediate? They mediate the process of inflammation. So these are the chemicals, the amines, cytokines. We'll talk about them in a subsequent video. There is an entire unit in this entire chapter dedicated to them. But these mediators will actually initiate the process of inflammation. Okay. Now the rest of the picture, whatever you can see, this is actually the typical inflammation sequence. Okay. So in that we see that there is recruitment of the leukocytes. The leukocytes are the major host defense component which will bring about the offending agent removal and thus bring about inflammation process. So they need to be recruited, they need to be brought to the site, right? So in that we will see that macrophages and granulocyte actually typically neutrophils, they are more or less the most effective inflammatory soldiers. They are the leukocytes which bring about the most destruction, you might say. So they are recruited more or less, and recruitment of leukocytes, and what they will do, they will eliminate or remove, this is the third R, the microbes. And as I mentioned, inflammation is not just about removal of microbes or the offending agent, but the dead tissue, the injured tissues as well, right? So this is the third R, and this entire thing is actually obviously it's being regulated. So that is the fourth R, regulation. And last but not the least, if I can show you, repair, which is the fifth R, as you can see, right? So this is more or less, now obviously we'll be going into a lot more details later when we talk about the actual inflammatory processes in a lot more details, but this is more or less, I'm just trying to create a generalized overview of what we are about to experience in the subsequent discussions. Okay, so these are the 5 R's which are typically the inflammatory sequence. Done. Now, as I was mentioning, that inflammation can be of several types, but the most broad classification of inflammation is acute and chronic. Now, acute, chronic, these are two terms which will be very much used throughout pathology. Throughout pathology, they will be very much used, and hence we need to actually familiarize ourselves with these two terms, acute and chronic. Acute, typically what it means is that anything which is acute, a disease which is acute, a response which is acute, it means that it is short-lived, it is immediate. Whereas chronic very roughly means that it is persistent. So if I say that the inflammation is acute, it means that the onset of inflammation is fast, within minutes or even hours. Okay, it can be hours, but it's typically within minutes the inflammatory process it starts. Whereas chronic inflammation, the onset for that is days. It takes days to actually initiate the chronic inflammatory process. First, let's get on with the differences, and then I'll actually explain in detail as to what these two terms mean. Now, I mentioned that leukocytes are recruited. In that, I also mentioned that neutrophils and macrophages, monocytes actually, they develop into macrophages, and lymphocytes as well. These are more or less the most common leukocytes to be recruited because they are the most effective in dealing with the offending agents because they are phagocytic in nature. Okay, it has been seen that neutrophils are very fast to respond, very fast to respond to the offending stimulus. So they are the first to reach, and hence they typically constitute acute inflammatory process, or the acute inflammatory response rather, because acute inflammation is fast in onset. Whereas the monocytes, they develop, they mature into macrophages, and lymphocytes, they are slower. So they typically constitute the chronic inflammatory sequence. So this is another important difference between acute and chronic inflammation. Now, acute inflammation, for that I had mentioned, not for acute inflammation, but for inflammation as a whole, when I was talking about its definition, I had said that there is always some collateral damage. It's a double-edged sword. In case of acute inflammation, this collateral damage to the host tissue is usually mild and it's limited. But chronic, the host collateral damage is severe and progressive. Okay, another very important difference. Now, the local and systemic signs for acute inflammation, they are prominent, as I'll discuss in just a bit, whereas in chronic inflammation it is less. I'll come back to this point later, don't worry. Now, the offending agents, this is what I had mentioned before, and this is the point. This is the point which will actually define what acute and chronic inflammation actually means. Okay, from this point I will explain the entire acute and chronic inflammation, and I hope you would be able to understand them and not just mug up. Okay, the objective here is not to mug up but to understand. Offending agents are readily eliminated, whereas offending agents in this case are not readily eliminated. Now try to understand what I had said before. Sometimes the offending agent can be such that they can be very easily eliminated. In that case, the inflammation sequence which would take place will be fast. It will be fast in initiating, it will be fast to end also, and it would recruit the one leukocyte which is very fast to actually reach the site and to carry out its function, which is neutrophil. The tissue injury, since the offending agent is easy to eliminate, will be mild to the host. Host would be damaged less because it's easy to eliminate the offending agent. So collateral damage is less. And the systemic and local signs, they will be prominent. Why? Because you are actually eliminating the offending agent very fast, right? So a lot of things are happening very fast in the site of inflammation. This will be physically or externally manifested in certain cardinal signs, which I'll come back to later. These are very prominent in acute inflammation. So, can you now understand what acute inflammation is? It all stems from the offending agent. What exactly is the stimulus for the inflammation to occur in the first place? That decides what kind of inflammation would be. Now suppose if the offending agent is not readily eliminated, there can be a host of reasons why the offending agent can be difficult to get rid of. If I can exemplify one reason, suppose the offending agent is a host tissue itself. It's an autoimmune reaction, suppose. As we will see in the etiology section, that is a very big reason for inflammation, autoimmune reactions. So suppose the offending agent is a host cell, a host tissue itself, then it would be very difficult for the inflammatory response system to either ignore that or to eliminate that, because it's a part of the host system. So that would actually mean that the inflammation would go on for days. It would take time to obviously start, and it would go on for days, years even. Okay, which would mean that the slower leukocytes, they will be the one to respond, right? And the tissue injury in this case will be progressive and severe. It would progressively stack up because it's going on for days and months and years. So the host collateral damage would be severe in this case. And the systemic signs, this time whatever is going on is a lot slower. It's a lot slower. There is no immediate rush in the response as far as inflammation is concerned. So the local and systemic signs are less prominent. Okay, it's not just less, it's actually less prominent. They are not that visible externally. So this is how chronic inflammation occurs. Many times acute inflammation actually develops into chronic inflammation, because when an injurious agent that has been detected by the resident sentinel cells, then obviously the first reaction of body would not be chronic inflammation, it would be acute inflammation. Then when acute inflammation fails, many times what happens is that develops into chronic inflammation, because now the body, our host system, tissue system, that actually starts to realize that, oh my god, this is an offending agent which cannot be eradicated readily. So let's start with the chronic inflammatory process. So many times acute actually develops into chronic, and many times what happens is there is a combination of both. There is a combination of both throughout the body. So it's not very clear cut many times. Acute and chronic, they are both combined. The inflammatory response is not clearly demarcated as to what it is. But anyways, that's not our point of discussion. So this is more or less what acute inflammation and chronic inflammation is. Okay. Now, the etiology. This is what I was talking about. What are the causes for inflammation to take place in the first place? So, why inflammation is occurring? For understanding that rather, you need to go back to the definition of inflammation. I had mentioned that inflammation is what? It's a host tissue response. It's a host tissue response, right? To what? That is what we'll be studying. But we know that it's a response of our body to some kind of injury, some injurious, something damaging. So anything which is damaging enough can cause inflammation in our body. Anything which our body needs to eliminate would actually elicit the inflammatory pathways. So the first thing is obviously, couldn't have been more obvious, infections. And a host of infections. It can be bacterial, viral, fungal, parasitic. They are the most common cause for inflammation. Okay, no problem in that. Then we come to tissue necrosis. This was something that was given in the picture. I had mentioned that whatever may be the reason for this necrosis to have occurred. Now, what necrosis is, we'll talk about that later when we talk about that chapter, cell injury, cell death. But whatever be the cause of the cell death and subsequent necrosis, these necrotic cells, I had mentioned this, that they will release certain factors which would initiate the inflammation process. So these are two very important reasons. Third, now remember, I had said that anything which is damaging enough can cause inflammatory pathway initiation. So trauma. Now trauma can be caused by physical agents like suppose some kind of burns. It can be thermal burns, whatever. Some burn, something a burn, traumatic enough to damage host cells. Okay, and it can be some chemical agents as well, right? Some kind of toxin. In physical, we might also say radiation, toxins, right? The idea here is that it has to be damaging enough. Anyways, then again we come to foreign bodies. Now we had talked about infections, but when we talk about infections, mostly what we mean is the microbial infection. Right? That it can be bacterial or viral or parasitic, all of those. But sometimes it can be something a little larger, a little bigger. For example, it can be, suppose, dirt or a splinter. So these, if they get inside our body, many times it happens. Splinter, it's a very common, road accidents, or in many cases, splinter gets in, right, invades the body, and it cannot be really detected or recognized by our body as a part of its own thing. So it's not part of our body, so it's a foreign body. So that is actually recognized by the sentient cells, the sentinel cells rather, not sentient cells, and they will elicit the inflammation process, because inflammation means it would try to remove anything which is damaging. So obviously easy to remember, or rather easy to understand. And this is what I was talking about, the last point, immune reactions. Immune reactions or hypersensitivity reactions. Hypersensitivity reaction is very important. We'll talk about this in great detail when we talk about the immunity chapter itself. Okay, there There's an entire chapter in pathology, in microbiology also. Anyways, so sometimes, and this is where things get a little tricky, we have certain self antigen issues, right? So directed against them, sometimes antibodies develop. This is the basis for autoimmune reactions, right? So in that case, many times hypersensitivity reaction occurs, or very sustained chronic inflammation starts, as I had discussed before. This is chronic because it's not easy to get rid of this antigen or of the host tissue, which the body has turned hostile against. It's not easy to remove that, but it's also not easy to ignore that, right? So this actually initiates a chronic inflammation and not acute inflammation, as I had mentioned before. Okay, so this is more or less the entire overview for what inflammation is, what causes it, the types of inflammation, the more or less the generalized overview of how a typical inflammation process goes down. Now obviously we will be going on into a lot more details when we talk about acute inflammation individually. We will talk about acute inflammation, how that occurs, and the different chemical mediators for such inflammation in the subsequent discussions. So I hope you understood today's discussion, and yeah, thank you very much, and I'll see you very soon, I promise. Thank you.